I'm going to call Lewis Wall.
Thank you, Mr. Chair. I neglected to add in my earlier contribution that actually the Minister received some advice about this piece of legislation from Treasury. So it was one of the 12 recommendations in his briefing. And just a quote from that report, the Treasury said to the Minister to identify and remove unnecessary barriers to workforce flexibility by progressing the health practitioners' replacement of statutory references to medical practitioners bill was important, and that it also highlighted that this was a really good opportunity for the Minister to show some leadership in this area. I neglected to say earlier that there is a huge imbalance in our country between the number of doctors we have and the number of nurses that we have. So we've got approximately 14,500 doctors, and we know in 10 years' time over 40% of those doctors are going to be retiring. And we actually have 49,769 registered nurses and 2,815 enrolled nurses, and there are 145 nurse practitioners. But what's been interesting to note is that in the nurse practitioner area, actually it's providing a really good opportunity for Māori and Pacific nurses to take the next step in terms of qualifications. And so what I've seen from some of the results today actually mean that for Māori and Pacific who have invested their time and energies into this particular sector, there's an opportunity for equity. And so because the nurse practitioner vocation will be able to undertake all these previously unlawful statutory functions that were only the domain of doctors, it's actually provided a huge opportunity and a huge business opportunity, I think, for our Māori and Pacific women. That really, I don't think, has been factored into the debate as much as it could have. I think it's going to be one of those unintended consequences. I don't think the Treasury highlighted it, and it certainly hasn't been highlighted in any of the advice that we have received from the officials. But I think into the future, it's a wonderful opportunity for Māori and Pacific businesswomen, and actually women per se, to pursue this nurse practitioner vocation. So I will be doing as much as I can to talk about the opportunity, and I in fact think that there should be a paper possibly that is prepared for the Minister about how we promote this opportunity across our communities, because from my perspective I think what's happened through the passage, or what will happen through the passage of this bill, just provides so many amazing opportunities, and particularly for women living in rural communities. So I know that we're all really keen to progress the passage of this legislation, but I just felt I needed to add to my earlier contribution, and particularly because our leader, the Honourable Annette King, isn't here in terms of our health committee and our lead in the health area. So I felt she would have wanted me to, at minimum, put that case to the House in terms of our support for it. But I'm really excited that the public are going to have more competent health professionals that they can now access their services from. And I see this, as I said before, as an amazing opportunity for women and actually women to get some parity and equity. And so we will be looking, I think, very closely about how the remuneration for this particular profession progresses. It should become comparable to the salaries of doctors, and I think, again, this provides a really good scope or area for us to really scrutinise into the future. Thank you, Mr. Chair.
I call